Mr. Martin Foley.
Thank you, Elizabeth. And I thought St Kilda was the centre of the universe, so I'm surprised that Kim could think the centre of the universe could possibly be on this side of the Yarra. Can I begin by apologising for being late, and I hope I haven't disrupted your important work. And can I thank you, Elizabeth, for that kind introduction. And I begin by acknowledging that we meet here on the traditional lands of the Kulin Nation, and pay my respects to elders past and present, and any elders who may be with us here today. Particularly pay my respects to the Wurundjeri and Bunurong people, and acknowledge that their contribution to a caring community, the same as VICSERV's, is an important part of why they are the longest continuously operating culture on the planet. And it's a great pleasure to be part of your annual general meeting and policy forum here today. The work you do, the representation of the people and the members that you work on behalf of is absolutely indispensable for the mental health services and indeed the wider community delivery services in Victoria. And I thank you for it, and the Andrews government thanks you for it. In fact, without your collective work and leadership, to be pretty blunt about it, the system wouldn't work. I'm sure you will agree how important it is that in the context of that, this government, indeed any government, it's important that we take the time to talk to you about the support for people experiencing mental health issues, their families and their carers, and the important role that you collectively bring to that policy area. The Andrews government is committed to providing world-leading mental health services for Victorians experiencing mental health problems and mental health disorders. And of course, there is plenty to do in that space. We all need to resolve to continue to provide that leadership in mental health policies and programs based on a comprehensive and integrated approach of research, of evidence, of innovation and of service delivery. This approach and our engagement with peak member organisations like yours and individual organisations is vital in light of the big changes that are coming our way, that are well and truly in the pipeline at both the Commonwealth and state level, and the important shaping that they will deliver of social support. As many of you know, the biggest of these challenges, and the one that's in the process of being rolled out, is the National Disability Insurance Scheme. Earlier this year, just a couple of months ago, the Andrews government signed a bilateral agreement with the Commonwealth outlining the rollout of the NDIS in Victoria over the next 3 years, starting from July of next year. And once fully rolled out, the NDIS will, I am confident, see the end of the current system of waitlisting of people with disability, particularly those aged under 65. This is, I'm sure, well-established ground, but it does bear repeating. It is estimated that this will see 100,000 plus people in Victoria assisted in a more comprehensive way than we had seen under the existing disability specialist support system. Under the NDIS, individuals or participants will receive a more appropriate, considered and personalised funding package relating to their needs. They will decide on what support services they want and need. It sounds terrific in theory, and it is, but it's how it plays out in reality. At its heart, the scheme is about providing choice and control to those people with disability so they can access and get the support they need when they need it, and built around their recovery goals. But I'd also like to emphasise that people who don't fall within the remit of the National Disability Insurance Scheme, should they not become participants and clients, that the Victorian Government is not only obliged but is planning and working on the basis that we will continue to support them and their families, whether they're in the system, whether they're transitioning to the system, or whether they don't qualify for that system. let me stress that nobody will be left behind through the National Disability Insurance Scheme's implementation. And that comes with some substantial policy and resource obligations on our part. The National Disability Insurance Scheme is rightly considered a wonderful national opportunity for development and delivery of better social support and community support and civic engagement for people and carers and families that have been locked out of participation in our society. And it will provide a greater range of support services. It will mean greater choice for people, but the issue around psychosocial disability, which is the frame the NDIS are using to get allocation into the system and support for families and carers, will, if you are in the system, I'm confident, provide a greater range of support and providers services. I know the transition to any such system is and will continue to be stressful for the sector that we're talking about and engaging with here today. I know many of you have raised issues about support under the new system for people experiencing severe mental illness and their carers. And in fact, VICSERV has a place at the newly established task force for the whole of government that we've established in Victoria to make sure that those concerns are heard. I understand these concerns and I understand what has caused those concerns. And the government is currently considering and working with both not-for-profits and increasingly making representations as recently as last Friday to the Commonwealth about making sure that those 2013 commitments are delivered on in reality. I don't know if people saw the piece in yesterday's online Guardian, where now the federal government, the federal treasurer is now talking about, instead of a $5 billion gap in the Commonwealth funding, that's now a $7.6 billion funding gap in how they are approaching the National Disability Insurance Scheme. Having said that, the Federal Treasurer also was clearly saying that the NDIS would be the first port of call on any social services dollars that the federal government creates. Our concern is at the cost of what else in the social service system and what perverse impact that would have, not just on what we do, but what you do. And we are considering how, in that context, a number of programs and integration of the NDIS programs and the notion of programs that aren't in the NDIS need to be shaped and reshaped to deliver on the complementary community care system once the NDIS is fully operational. And against that background, clearly in 2014, the former government sought to position the community-based mental health services as a part of the preparation for that. Many of you will be aware that we commissioned an independent review undertaken by Aspect Consulting and asked them to consider how that service delivery system and changes had rolled out. And that review highlighted some of the issues that seriously warrant pretty important attention in both the mental health community support services and the drug and alcohol treatment services. In fact, it has shown a perverse, unintended, but frankly predictable outcomes from that badly structured decision. We are considering, and you will share with us in the very near future, that report, and we are considering how the issues raised will be addressed in order to make sure that that reality of an integrated service response for clients and programs is delivered, rather than re-establishing unhelpful silos across services. So, against this background, how the government then approaches the next big set of changes about the delivery of our commitment to a comprehensive 10-year mental health plan for all Victorians is an important part of setting the frame. We made a commitment that we would deliver a 10-year mental health plan within the first 12 months of government, and yes, that's not very far away, and we will make sure we deliver on that commitment. That 10-year mental health plan, again, which a number of you have had input into, will set out what we need to do, is what I'd like to think is the common ground that we can then go forward and pursue resources, pursue policy, pursue programs around. And we want to make sure that that 10-year mental health program sets out the agreed ground. To make sure that people have access to mental health services that are timely and relevant. That we want to make sure that we reduce the number of deaths by suicide. That we want to prevent people slipping through the gaps with unmet treatment and support needs in the mental health services. We want to ensure better and more accessible early interventions in a community setting, resulting in reduced demand on crisis responses. We want to support better physical health outcomes and achieve lower mortality rates for people in the mental health system. And we want to ensure that people receive better, integrated and connected services. We want to make sure that design and delivery of services are informed by and delivered in partnership with mental health consumers and their families and carers. These are easy things to agree on because they come from the work that you have done and the work that others have done. The magic is at finding the sweet spot in collaborating and building from that common ground about the resourcing, the program and the policy delivery of those. There has been a strong response and a strong interest in the development of this mental health plan, and the fact that we had over 2,000 people, that we had numerous and overrepresented forums in the development of that, give me the confidence that if we are serious about implementing that, it will be through staying with you, not just a co-design of that document, but a co-design of the rollout of that document. And in doing that, we know that the co-design is important in that the number of people touched by mental illness and the recognition that mental health is a key to our overall society and community's well-being is a key outcome. I'm looking forward to officially launching that new plan once it is ticked off and completed within government, and making sure that we stick to the election commitment that we made. If I can just say a few more words about the aspect report and what it might then do to help shape that community mental health services recommission. It's my expectation that we would release that in the very near future, and that would help increase awareness of some of the challenges and the issues that particularly the community mental health sector that we need to pursue, and some of the changes that frankly reflect some of the contributions that VICSERV and your membership have made into that process. The Victorian Government really does have a big vision and a big plan that aligns with VICSERV's when it comes to mental health reform, but we cannot get there on our own. VICSERV is a key partner and indeed a key collaborator in delivering on that vision. The vision is the easy part. The rolling out and the delivery of the hard work of corralling resources in an environment where resources are always competitive, where they are always scarce, and where they need the active collaboration, and particularly when it's about shifting resources, challenges all sorts of existing institutional interests, is a particular challenge. VICSERV lead that debate. VICSERV and its members are an important ally in that shifting and changing of resources, and I'd like to think that the 10-year mental health plan, the response to the aspect report, and the response to the NDIS, and the no doubt numerous subsequent issues that are going to play out over the next 3 years of this Parliament and this government's life are going to provide plenty of challenges for us. But I am keen to find out from the policy forum work that you are doing today some of the practical nuts and bolts suggestions from that shared common ground, how we can achieve that. I look forward to continuing to work with VICSERV on all of these and no doubt other issues. I thank you for all your hard work. I wish you every success not just at this forum and at this future meetings, but the important work that you all do in all of our communities about making sure that not just we have better community mental health outcomes, but we have better integrated care outcomes for some of the most vulnerable Victorians and communities and their families right across our state. And I look forward to partnering with you in that very important work. And can I thank you all for being kind enough to